Thank you, Catherine and Sharon. Many congratulations on that great work Taiwan is doing. I'm Farah Mecci, patient advocacy lead for Novartis in India. Today we have a very special guest with us, Mr. Ram Khandelwal, a dedicated and passionate cardiovascular disease patient leader. He's the founder of the first heart health patient community in India, the Heart Health India Foundation, which started as a thriving Facebook community established 3 years ago with nearly 4,000 members who share an interest in cardiovascular space. This group serves as a valuable platform for support and awareness. Thank you so much for joining us, Ram. It's indeed a pleasure to have you. Before I begin this interesting conversation, there is this one number that I want all of you to make note of. 40% of the adult population are at a risk of a heart attack, which most often remains undiagnosed until a cardiovascular disease or a heart attack occurs. Therefore, why this was such a crucial initiative. Ram, the first question to you. Why did you feel the need to establish a patient community?
Farha, for me, this started on a very personal note. In 2019, when I was 33, I had a major heart attack, and my life was turned upside down during that phase of my life. And when I look back, I remember that in 2017, I had got my lipids checked and consulted my reports with the doctor, and high level of LDLC was there. Uh, Doctor did mention to me about taking medicines for about 2, 3 months, but he never told me the uh, issues which I can have in long run, and how do I overcome this. And I felt a lot of gaps in awareness, and that's when I was recovering, I and my wife, we started this community to bridge the gaps in awareness.
Thank you, Ram. Ram, what were the key challenges and barriers that are faced by patients and patient communities in the heart health space?
So, first of all, I think there's a lot of awareness related gaps. People don't know about various factors which lead to heart diseases, how to get tested, when to get tested, what kind of actions to be taken. So, a lot of these gaps exist in the community today. And when we started this community, we started talking about a lot of things, but we never knew that patient engagement or patient advocacy can make a big difference when it comes to disease awareness. And I think that's what we led to our evolution, which we have when we partnered with APPISx.
Speaking of APPISx, Ram, how did APPISx manage to address the issues and barriers that you were all facing?
So APPISx was a game changer for us. It was a long journey and a continued association. Through APPISx, we formed a panel where we had unblocked ambassadors coming from various regions of India, which wanted to advocate for better heart health. We also had a number of sessions with medical doctors where we learned medical terminology, we understood how heart functions work, and different scientific aspects to it. And later on, it culminated with a very useful 2 day workshop wherein we had the opportunity to meet other patient groups like Friends of Max, Cure SMA, and Blue Circle Diabetes Foundation, learning about their journey and how they have engaged community. So it helped us in a lot many ways to dream bigger and better.
Wonderful, Ram. I think so. Surely, APPIS India was very curated to the needs that there was, and then how do we really have a session that is tailored to answer and to look at these unmet needs. Ram, before I let you go, I want to know from you what are those three things that you are most proud of about what HHIF has achieved so far.
So during APPISx workshop, Farha, we learned the journey of these patient groups, and from their journey, we could draw a lot of parallels. And using that, I think three things which are really important for us right now. We are establishing a partnership with government where we could collaborate with National Health Mission and exploring if we can offer community support to hospitals which are catered through government network, and creating this kind of mechanism in place. Then we're also developing relationship with the centers of excellence in cardiology, wherein we want to carry out awareness activities in these hospitals and offer community support. And lastly, we've also been able to form a panel of scientific advisors who are helping us taking care of all the medical and scientific aspects to give the right kind of information to our community and potential people who are at risk factors, to make sure that they are getting the right information and the right community for the support.
Thank you so much, Ram. And I must call out here before we end the session that it's been within what 4 months of an APPIS India chapter that you've been able to register the first heart health patient community with the government of India. It's truly, truly commendable. More power to all of you, and I hope you continue to champion the cause of heart health in India. And it's been an absolute pleasure to have you with us. Thank you so much. Over to Duo for the closure.